Have you ever woken up unable to move? Your mind is awake, but your body feels completely frozen. You try to scream, but no sound comes out. You might even see strange figures in your room or feel like someone is sitting on your chest. If this sounds familiar, you've likely experienced sleep paralysis. Today, we're diving deep into this terrifying but surprisingly common sleep disorder. We'll explore what sleep paralysis really is, why it happens, who gets it, and most importantly, how you can prevent it from happening to you. Stay with me because by the end of this video, you'll understand everything about sleep paralysis and never have to fear those scary nighttime episodes again. What is sleep paralysis? Sleep paralysis is a temporary inability to move or speak that happens when you're falling asleep or waking up. During these episodes, you're fully conscious and aware of your surroundings, but your body is completely paralyzed. Think of it as your brain being awake while your body is still in sleep mode. It's like being trapped inside your own body, which is exactly why it feels so terrifying. These episodes typically last anywhere from a few seconds to several minutes. While it feels like forever when you're experiencing it, most episodes are actually quite brief. The condition affects millions of people worldwide, yet many don't talk about it because they're embarrassed or think something is seriously wrong with them. But here's the truth. Sleep paralysis is more common than you might think. The science behind sleep paralysis. To understand sleep paralysis, we need to talk about what happens during normal sleep. When you sleep, your brain goes through different stages, including REM sleep, which stands for rapid eye movement sleep. This is when most of your vivid dreams occur. During REM sleep, your brain naturally paralyzes most of your muscles to prevent you from acting out your dreams. This is actually a protective mechanism called REM atonia. Imagine if you could move freely while dreaming about running or fighting, you'd probably hurt yourself or others. Sleep paralysis happens when this natural paralysis continues even after your consciousness returns. Your brain wakes up, but the signal to reactivate your muscles gets delayed. This creates that terrifying experience of being awake but unable to move. The hallucinations that many people experience during sleep paralysis occur because your brain is still partially in REM sleep mode, where dreams happen. So you're essentially having dreamlike experiences while you're awake. Types of sleep paralysis. There are two main types of sleep paralysis. Isolated sleep paralysis is when sleep paralysis occurs by itself without any other sleep disorder. This is the most common type and usually happens to otherwise healthy people. Recurrent sleep paralysis is when episodes happen regularly and may be connected to other conditions like narcolepsy, sleep apnea, or other sleep disorders. Sleep paralysis episodes are also classified by when they occur. Hypnagogic sleep paralysis happens as you're falling asleep, while hypnopompic sleep paralysis occurs as you're waking up. The waking up type is much more common. Common symptoms and experiences. The main symptom is obvious. You can't move your body despite being fully aware. But sleep paralysis often comes with other frightening experiences. Many people report feeling pressure on their chest, as if someone is sitting on them or pressing down. This happens because the muscles that help you breathe are also affected, making breathing feel more difficult. Hallucinations are incredibly common during sleep paralysis. These can be visual, like seeing shadowy figures or intruders in your room. They can be auditory, like hearing footsteps or voices. Some people even report feeling like they're being touched or that someone is in the room with them. These hallucinations fall into three categories. Intruder hallucinations involve sensing a presence in the room, often perceived as threatening or evil. Incubus hallucinations create feelings of pressure on the chest and difficulty breathing, sometimes with a sense of being choked or suffocated. Vestibular motor hallucinations involve sensations of floating, flying, or out-of-body experiences. The combination of paralysis and these vivid hallucinations explains why sleep paralysis has been linked to supernatural beliefs throughout history in many cultures. Who gets sleep paralysis? Sleep paralysis can affect anyone, but certain groups are more likely to experience it. It typically first appears during teenage years, with most people having their first episode between ages 14 and 17. However, it can start at any age. Studies show that about 8% of the general population experiences sleep paralysis, but this number jumps significantly in certain groups. Students and shift workers have much higher rates, sometimes up to 28%. People with mental health conditions like anxiety, depression, PTSD, or panic disorder are also more likely to experience sleep paralysis. There seems to be a strong connection between stress, mental health, and these episodes. Interestingly, sleep paralysis appears to run in families, suggesting there might be a genetic component. If your parents or siblings have experienced it, you're more likely to have it too. Risk factors and triggers. Several factors can increase your chances of experiencing sleep paralysis. Sleep deprivation is the biggest trigger. When you're not getting enough sleep, your brain's normal sleep cycles get disrupted, making sleep paralysis more likely. Irregular sleep schedules also play a major role. Shift work, jet lag, or frequently changing your sleep times can trigger episodes. Stress and anxiety are significant contributors. High stress levels can disrupt your sleep quality and make sleep paralysis more frequent. Sleep position matters too. People who sleep on their backs are more likely to experience sleep paralysis than those who sleep on their sides or stomach. Substance use, including alcohol, caffeine, and certain medications, can also trigger episodes. Other sleep disorders like sleep apnea, restless leg syndrome, or narcolepsy increase the risk. Mental health conditions, particularly anxiety disorders, depression, and PTSD, are strongly linked to sleep paralysis. The cultural and historical perspective. Throughout history, different cultures have tried to explain sleep paralysis through folklore and supernatural beliefs. In many Western cultures, it's been called old hag syndrome, referring to the belief that a witch was sitting on the person's chest. In Mexico, it's known as "Si me subió el muerto," meaning the dead climbed on me. In China, it's called pinyin, which translates to ghost oppressing on body. In Japan, the term kaneshibari means bound by metal. These cultural interpretations show how universal and frightening this experience has been throughout human history. Before we understood the science, people naturally turned to supernatural explanations for something so terrifying and inexplicable. Diagnosis and when to see a doctor. Most people don't need medical treatment for occasional sleep paralysis episodes. However, you should consider seeing a doctor if your episodes happen frequently, more than once a month. Sleep paralysis is affecting your sleep quality or daily life. You're developing anxiety about going to sleep. The episodes are getting worse or more frequent. You have other concerning sleep symptoms. A doctor will typically ask about your sleep habits, medical history, and the frequency of episodes. They might recommend a sleep study if they suspect you have other sleep disorders. There's no specific test for sleep paralysis, but doctors can rule out other conditions and help identify triggers that might be causing your episodes. Treatment and management. The good news is that sleep paralysis is manageable, and there are several effective approaches. Improving sleep hygiene is the most important step. This means getting 7-9 hours of sleep each night, going to bed and waking up at the same time every day, creating a comfortable sleep environment, avoiding screens before bedtime. Stress management is crucial since stress is a major trigger. Techniques like meditation, deep breathing exercises, yoga, or regular counseling can help. Treating underlying conditions like anxiety, depression, or other sleep disorders often reduces sleep paralysis episodes significantly. For severe cases, doctors might prescribe antidepressant medications, particularly those that suppress REM sleep. However, medication is usually only considered when other approaches haven't worked. Cognitive behavioral therapy can help people develop better sleep habits and cope with the anxiety that often accompanies sleep paralysis. Prevention strategies. Here are practical steps you can take to reduce your risk of sleep paralysis. Maintain a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Create an ideal sleep environment. Keep your bedroom cool, dark, and quiet. Invest in comfortable bedding and consider blackout curtains. Avoid sleeping on your back. Try sleeping on your side or stomach instead. Limit caffeine and alcohol, especially in the hours before bedtime. Manage stress through regular exercise, meditation, or other relaxation techniques. Stay physically active, but avoid vigorous exercise close to bedtime. Address mental health concerns. If you're dealing with anxiety, depression, or trauma, getting proper treatment can significantly reduce sleep paralysis episodes. Avoid large meals and electronic screens before bedtime. What to do during an episode. If you find yourself experiencing sleep paralysis, here are some techniques that might help. Stay calm. Remember that the episode will pass, usually within a few minutes. Focus on small movements. Try to wiggle your fingers, toes, or